Thank you all so much. I want to just take a minute to thank you for turning out today. This is a wonderful turnout. This has been a wonderful year. You're all an incredible inspiration. I'd like to say a special hello to Bobby Gibbs, who for many years has been an inspiration. We're so grateful that you're part of the ALS and Angel family. Thank you for being here.
So 16 years. That's incredible.
It's incredible. It's remarkable what the Angel Fund has done for us in these 16 years. Because what they've provided is a discretionary source of resources, both monetary and otherwise, which has really helped us at pivotal points in some of our projects. And I can't overstate how important that has been.
And it is a very exciting time in the world of ALS research. You shared some fantastic news with people today.
Yeah, it is very exciting. So there is, for example, a new ALS drug that was just approved by the FDA, just now becoming available, and which will be tried by many of our patients in clinics across the country. And then through the support of Angel Fund and other groups, we were able to try for the first time an intervention in a patient to turn off an ALS gene. And we know that that works remarkably well in a model of ALS in mice. Don't know yet if it'll work in people, but it seems to be safe. And we're just thrilled that thanks to the Angel Fund support, we've been able to now move this into actual human trial, with hopefully other patients coming along behind the first patient. So this is a big and exciting time for us.
Well, and I think the key word I hear from a lot of people, and we see on the balloons as they head out, is hope. And this is certainly a reason to give them hope.
There's never been more reason for hope in ALS than right now, with a lot more things also just around the corner that are going to be tried in the coming year. So it is a spectacular year for progress and hope, for sure. Yeah.
What I love about today, I saw you, Rich, and friends out there thanking people and greeting them as many of the walkers came by.
Yeah, it's hard adequately to say how much their support means. And so it's great on a beautiful day like this to have a chance to talk to people face to face, only briefly, but face to face, shake their hands and say thanks. It means a lot to us. And they inspire actually the whole team in the lab, who come here and see this incredible outpouring, and it really motivates everyone.
And today is also a fun way for friends and families to support this great cause.
Yeah, it really is. It becomes almost like a celebration of the word you used, of hope. Obviously, there's always a cognizance of those who've gone before, who've lost their battle with ALS, but that's motivating. We celebrate what they did, and we celebrate what we're going to do going forward.
What I also love seeing out there, we have everything from probably grandparents, children, even dogs out joining the forces.
Yeah, that's right. So the diseases are sometimes multi-generational, and the celebration and the hope and the hard work is also multi-generational. And it all resonates very well. And again, it's terrifically motivating for all of us in the lab, I have to tell you.
Talk about your team.
We have a wonderful team. We have basically our own team immediately within my lab, but then we're very lucky to work with several other laboratories that each work on different parts of gene silencing. So the effort is much bigger than just our group. You know, we have maybe 16 or 17 people in my team, but our combined teams begin to count into 40, 50, or 60 people basically across multiple laboratories. And again, that emphasizes that this is a community effort. It's not one person, it's not one lab, it's a community effort. It's essentially everybody working together.
In talking with Dr. Brown, it is a very exciting time to be part of the ALS research.
It is. I've been doing it a lot of years with him, and so we're at a time where we're finally moving into some clinical trials for our patients that we see every day. So it's very exciting for us. Always keeps us on edge, particularly now. The patients have always been so willing to come forward and try, and we're there to try with them really hard.
And what does it feel to your research team when you come here and you see smiling faces and people and kids and dogs and everybody else?
It's amazing, and it definitely motivates you to do more research and, you know, find a possible cure for ALS and help. You know, it's definitely motivating. Yeah.
And talk about working with Dr. Brown, if you would.
Working with Dr. Brown is great. His energy really is just amazing. Every single day we have so much going on in the lab, and he's just on top of absolutely every project. I swear, got more energy than all of us put together. And it's these kind of events that I think inspire him and inspire all of us.
And this isn't the entire team. There's other members, I imagine.
Right, there's a lot of other people on the team. We had a few people here today that went back a little bit earlier because they've got a long commute. But there's a whole big team of us at the lab, yeah.
And there's a lot of ways to support this team, aren't there?
Yeah, there's definitely a lot of ways. You know, you can join the research team. That's one way, through donations and so forth. There's a lot of many ways too.
And tell them, if they join a team, they can have a snazzy shirt just like you guys.
Yeah, we're glow in the dark with these, I think. But the families that are here at this walk every year, they've been here for years and years, many of them, some new families, but it's just such a motivating environment to come and see them every year. And their teams get bigger. They're here to raise funds because they're as hopeful as we are that we're gonna get that answer. We're gonna get it, and we're gonna get it soon, I hope.
Thank you, ladies. Thank you for all your work, too.
With the support of the Angel Fund, we've been able for the first time in a human to begin using a therapy delivered by a virus that turns off ALS genes. That went into the first patient in July. We're doing the second patient in 2 weeks in collaboration with colleagues at the MGH. We don't know yet if it will work. We do know that it's safe, and we do know that it's a whole new approach that's never been tried in humans, and we're enormously excited and enormously appreciative of the Angel Fund because the funds that you raise have made this possible. And I will tell you that we have another approach for turning off a gene, which we hope will be in patients within the year. So this has been a wonderful year behind us, and we look forward to a great year ahead. Thank you all so very much. I see the sign, hope. This is certainly a year of hope, and we appreciate working with you to make all the hopes come true. Thank you.